Hello. So today I'm going to talk to you about the stages of heartworm disease. Now, this is not going to be exactly as it's written in the literature, but it's going to be the way that it helps me remember it. There are 4 stages of heartworm disease, and we have to do some diagnostics to stage them. Typically, we're going to have to do blood work. We're going to have to do x-rays to look at the vasculature of the lungs and the heart itself and whatnot. So in my head, I kind of think of stage 1 as it shows up on the test, but there's no sign in the dog and there's no sign on the diagnostics. Stage 2 is positive on the heartworm test, no sign in the dog, but we do see some changes in the diagnostics. Stage 3 is the heartworm test is positive, but we have changes in the dog and in the diagnostic. So we have coughing, we have exercise intolerance, all those things. And stage 4 is what's called Cavel syndrome, and that's your fatal version of heartworm disease. Those are the dogs that typically have difficulty breathing, they'll have fluid in their belly, they'll get a big bloated belly and whatnot. Your classic injectable treatment, we're typically going to be relatively safe in a stage 1 and stage 2. It starts to get iffy in a stage 3, and I personally don't recommend doing injectable heartworm treatment for stage 4 Cavel syndrome dogs. There are some people that elect to do the full in-depth where they actually go into surgery and they pass a catheter up one of the major arteries and into the heart and remove the worms that way. That surgery is a little bit dangerous because you're removing worms from a heart. But usually for Cavel syndrome dogs, unfortunately, we're either talking medical management of the other stuff, so the fluid that builds up in the abdomen, the heart failure, those kinds of things, versus considering humane euthanasia. I have had a couple of patients before that we have gotten their heart failure and whatnot enough under control that we were able to do injectable treatment, or we were able to do the slow kill while they're on medications for heart failure, but it's not super common. Cavel syndrome is a dangerous and very hard to treat particular disease in dogs. But those stages are important. When you see dogs coming out of rescues or shelters, they're not always going to stage them before heartworm treatment, but your general practitioner is typically going to stage because it helps us figure out if we need to adjust our treatment plan any and potential outcomes for the treatment of it.